Well, if you want to get that perfect smile, we're going to tell you exactly how you can get it. Joe visits a dentist's office where they take you from A to Z and you get a luxury experience. Take a look.
Spending time with Dr. Stephen Marsh in his office right here at the corner of Cedar and Brainerd Road. We are literally in your office.
Yes.
I love this because you have books here, of course, in the reception area, the before and afters, but we're going to see some before and after pictures. But why don't you show me around a little bit here? I like being behind the scenes.
Well, it's sort of interesting, Joe. We meet all our patients in here. I meet with them, another team member does, but we sit together and I want to hear their story. It's not passed on from one of my team members. We sit just like you and I are talking here. I say, what brings you here? What's important to you? I also find out a little bit about them, because that tells you a little bit about the person. Teeth are connected to a person. You want to know what finally got them to pick up the phone and make the call. We want to make them feel comfortable and reassure them that we're going to do what works for them, whether it's financial or number of teeth they want to do or what they want to accomplish. And the best way is not in a dental chair, but sitting around a round table where we're essentially equals.
And they could see, as my favorite part, looking at the before and after pictures. And I love the fact, too, that you are, well, you're so proud of what you've done. How many years have you been doing it?
Actually, 45 years. 3 in the Air Force and 42 in private practice.
Again, thank you for your service, and thank you for all the service you've given so many patients here. We're going to zoom in, if you will, and look at a number of particular patients here. But before we go any further, I want to make sure everyone watching realizes that's not real. Those aren't real teeth.
No, this is actually Hallie's. It's a wax prototype. And I mentioned that we want to make sure that we do what the patient wants.
Okay.
So before we move forward, we take impressions, often digitally, and we do a digital wax up of what they'll look like. And then they can look at it with me and they can say, I like this. Can you change this? Can you make this longer? I want to make sure that the result is predictable for the patient.
So this is not the finished product. This is what the finished product will look like.
And again, yes, and we can also make modifications if there are things we want to change so that you get exactly what you would like.
Well, let's get a little closer look at Hallie. I know you've got some before and after pictures with us.
Well, thank you. So this is Hallie, and she had decalcification when her teeth came in. She's a teacher. She was always bothered by that. And so we said, well, in this case, the only thing you really can do is reshape those teeth and actually put porcelain veneers on. Joe, we started with 6. We ended up doing 10 porcelain veneers, and you can see what a difference for her with her smile in front of the class, something she's really proud of, and something she had waited 25 years to do. And we were glad that she chose us to do it, and again, made her feel comfortable. Fred's an interesting case. He was very hesitant to do much work. He knew his teeth didn't look great. He was in his 60s. He's semi-retired. But his smile bothered him. His wife said the smile bothered him. He had chipped some teeth. So in the lower arch, Joe, we actually did a lower bridge to close the gap, if you will. In the upper arch, we did 4 porcelain veneers, and we were able to give Fred the smile that he wanted, and he wanted to make sure it was predictable, which is why we spent so much time beforehand. The third patient, Kyle. Kyle was going to be in a wedding, never liked the way his teeth looked, had moved to Cleveland from Indianapolis. We actually did 10 porcelain veneers on top. We did 6 on the bottom to give him a smile that was wedding ready. He was in the wedding party. And lastly, Lindsay. So Lindsay, her teeth had worn down. She moved to Cleveland from Pittsburgh. She was in school, graduate school. She said, I really want to take care of my teeth. We did all the uppers and all the lowers with crowns and veneers to give her a smile that she said changed her whole life.
I don't doubt it. Well, don't wait 25 years like a number of patients have probably told you. Please make that call to Dr. Marsh and his team at 440-461-1003. You can simply log on to the appropriately named website, clevelandsmiles.com. Doctor, thank you so much.
Always my pleasure, Joe.